All right.
All right. Okay. I'd like to get things started by introducing Dr. Mona Hanna-Attisha, who said I can call her Mona. So many of you are familiar with her work and hopefully met her during her book signing. And if you haven't read her book yet, which is entitled What the Eyes Don't See, A Story of Crisis, Resistance, and Hope in American City, I hope you take the time to read it because it's really riveting. It's amazing what one person can do to affect a positive change for thousands of lives. So you really must read it if you haven't had the opportunity yet. So let me just tell you a little bit about Mona and her impressive background. She's an Associate Dean for Public Health and a C.S. Mott Endowed Professor of Public Health at Michigan State University, College of Human Medicine. She's the founding director of the Pediatric Public Health Initiative, an innovative partnership of MSU and Hurley Children's Hospital in Flint, Michigan. She's a pediatrician, a scientist, an activist, an educator, and an author. She was named one of Time Magazine's 100 most influential people in the world and recognized as recognized as one of USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading recovery efforts. Let me just say that it is really an honor to introduce this incredible woman who courageously and tirelessly fought to bring public exposure and government acknowledgement to the Flint, Michigan water crisis. She fought for health and well-being of some of the city's most vulnerable citizens, including infants and children. Please welcome Dr. Hanna-Attisha.
Oh, thank you. Thank you. Thank you for that very lengthy and unnecessary introduction. It is so wonderful to be here with all of you, fellow Spartans. Chris, I'm so excited to have this conversation with a fellow alum of the College of Human Medicine. So it's great to be here. Thank you for having me. I kind of came into medicine accidentally. I grew up in Metro Detroit. I got really involved in environmental activism as a high school kid. I saw this connection between environment and your health, but also the role of kind of youth activism and what good government can do for people. So then I went to college to study environmental science. I was a tree-hugging environmentalist. That was what I was, and one protest to the next. And the more I did that science, the more I continued to realize the connection between the environment and health, and more so to children. Kids are most impacted by what happens in the environment. I was finishing college and I had 2 applications in, one to the Peace Corps and one to medical school. And I'm like, whatever I get into first is where I'm going. And I got into MSU. Yeah. So I got into MSU's College of Human Medicine, and it was a fit because MSU College of Human Medicine was created as the very first community-based medical school in the country. Our motto is service to people. Its focus is primary care and working with underserved populations. I'm like, this is what I want to do. I want to be at a place that truly helps people, and that's kind of that was consistent with kind of my passion, my drive, and what I want to do, and I ended up at MSU for medical school. MSU's medical school is special. It's always been supportive of non-traditional students, and women have been non-traditional students, which is great. We need more women physicians. As a faculty member at MSU, you are a researcher, you're an academic, and being an academic means many things. When you're in medicine, it means being a clinician, so I still see patients. It's absolutely joyful to continue seeing patients. We're educators as academics. I have learners with me all the time, and that is so much joy to be part of an institution that is not only doing good, but making sure we are training the next generation of folks to do good. So we're clinicians, we're educators, and we're researchers. So research is part of the work that we do. Research has always been, to me, about advancing the public good. Doing science, not just for science sake, but doing science to make the world better. as cheesy as it sounds, but that's what I believe science is for. I was going about my business as a pediatrician, as an educator, as a mom, as a wife, juggling a bazillion balls in the air, just like all of you do every single day. And I heard that there was lead in the water. And from that moment, from hearing the potential of lead in the water, that's when my life changed. So that's what kind of prompted me to see what was happening, tried to get help from government, and they just closed doors in every direction. And finally realized, as I have throughout my career, that I needed data, I needed science. I couldn't say I feel bad, or I think there's a problem, or we should do better. I needed data in my pocket. And fortunately, I had been trained as an academic to do research. So for the academics out there, like, how do we share our research? What are we supposed to do on a call? What do we do? Journals. We publish in journals. How long does it take to get something published? A year. So you're supposed to go through this really important process called the peer review process to publish your work, your research, or to present at conferences, and that takes a long time. But every single day that went by was another day that our kids were drinking something that could potentially impact their entire life course trajectory. So I did an academic no-no. I stood up in our hospital and had a press conference and shared this research. So you shared all these kind of crazy accolades that I've received. I think my favorite was an award I got from MIT called the Disobedience Award. and it was for being, which was so hard to explain to my kids that I got a disobedience award, but it was for being academically disobedient, for not going through that peer review process and sharing that research because it was a public health emergency. And I felt great. I'm like, yay, I'm doing my job as a pediatrician. Also, part of my job as a pediatrician is to be an advocate. That's how I was trained. And I felt good for half an hour. And then, as I share in the book, and then everybody went after me. The state went after me, the federal government went after me, saying I was wrong, that my research was wrong, that I was an unfortunate researcher. And my favorite, since this is a women's event, that I was causing near hysteria. And that word hysterical has been thrown against so many powerful, strong women over time. And I wore it as a badge of honor. But in that moment, when these very powerful forces go after you, it is hard. And I wrote this book in the first person because I wanted you to be in my shoes. I wanted you to go through that roller coaster that I was going through. And I began to second guess myself. I developed imposter syndrome. Like, maybe I'm not good enough. Maybe I'm not smart enough. Maybe my research is wrong. Maybe I shouldn't have done this. And fortunately, it was the quick realization that it wasn't about me. This wasn't about me. This was about my kids. This was about my patients. And that's what lifted kind of me up and gave me the courage to keep going. And finally, the state conceded. And once again, since then, we've been on this path to recovery. So this book and my story is what happened in Flint. It was kind of being at the center of one of the signature environmental and public health crisis of our time, the Flint water crisis. But the hardest part was the story wasn't over, but I had to end the book. So what we've been able to do since the water crisis has been pretty amazing, and MSU has been leading that work. We have built this model of recovery, a model public health program to mitigate the impact of the crisis and to, more importantly, share our best practices all over. This story is ultimately about who we are and who we want to be, and ultimately how we want to take care of each other. So we've been able to put into place so much awesome, once again, led by MSU, things like early literacy programs and home visiting support and nutrition prescription and Medicaid expansion and brand new child care centers, working with our friends at MSU Education. So the list goes on and on of all the good things that we've been able to do in Flint. However, I often feel like my hands are tied as a pediatrician. There is something that I wish I could prescribe my patients that isn't on the electronic medical record. Like I can't order it. And that's an antidote to poverty. So the work that I'm doing now is this big, bold, impossible Spartan's will effort to eliminate poverty in our babies. It's a program called RX Kids, Prescription Kids, and we are prescribing every pregnant mom in Flint and every baby in Flint cash. We're prescribing cash. We are the poorest city in our state, one of the poorest in the nation. Poverty is the root cause of so much of what makes my kids sick. So we are trying to do the impossible and trying to disrupt poverty and improve health equity. This has never been done before. There's pilots of this all around. There's a pilot here in Cook County on guaranteed income. There's other efforts that have done this with really small sample sizes. Nothing has been done like this for the whole city. But once again, MSU does big things. So we're really excited about this project. We're really excited to lead this at MSU in Flint and to quickly kind of share our best practices literally all over the country.